Hi, everyone. Good evening. It's a pleasure to welcome you to our next installment of the Inside the Operating Room webinar. It's a distinct honor to give you our welcome on behalf of the Latino Surgical Society. I'd like to start by sharing a little bit of our mission. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons. And on behalf of the founders and myself, I'd like to welcome you for our fourth installment tonight. We'd like to acknowledge our institutional members, the University of Washington, Seattle, the University of California, San Francisco, the University of Texas, Austin, Massachusetts General Hospital, and Oregon Health Sciences University. We thank you for your commitment to the Latino Surgical Society, and most importantly, to the faculty and residents and fellows who are at your institutions, feeling the support that you've provided through this commitment. I'd also like to introduce our new Latino Surgical Society interns, Yatsire Hernandez, Aldo Treviño, and Alicia Laguna Torres, who will be working with us over the next year with some behind the scenes work. They are all on their route to a career in medicine. We also have the distinct honor of having recruited our advisory board, and I'm going to list them out in alphabetical order. Dr. Miguel Cubano, Dr. Cristian de Virgilio, Dr. Adel Haider, Dr. Luz Maria Rodriguez, Dr. Carlos Pellegrini, Dr. Carmen Solorzano, Dr. Julianne Sosa, and Dr. Maria Soto Green. Last but not least, we're very excited to have Dr. Valeria Balbuena, who is a general surgery resident at the University of Michigan, and she has stepped into the role of director of our Inside the Operating Room webinar series for the upcoming academic year. So without further ado, I would like to welcome you to join us. We need to move forward together, and we can only do it with your support. Please look for our organization on our website, latinosurgicalsociety.org, and on our social media site at Latino Surgery. I'm going to go ahead and introduce our panelists today. Our session moderators today are Drs. Jesus Ulloa and Dr. Chantal Reyna. Dr. Ulloa is an assistant professor of vascular surgery at the David Geffen School of Medicine at UCLA and West LA Veterans Hospital. He obtained his medical degree from the University of California, San Francisco, and completed his vascular surgery fellowship at the UCLA Medical Center. Dr. Chantal Reyna is a first-generation physician and is the medical director of the breast program and chief of breast surgery at Crozer Health System. She's an international traveler, avid soccer fan, and reader. Tonight, we also have the distinct pleasure of welcoming Dr. Cristian de Virgilio for the fourth installment of our Inside the Operating Room webinar. Dr. de Virgilio is the chair of the Department of Surgery at Harbor-UCLA Medical Center, co-chair of the College of Applied Anatomy, and professor of surgery at UCLA School of Medicine. An Argentina native, he completed his undergraduate education at Loyola Marymount University and obtained his medical degree from the University of California, Los Angeles. He completed his general surgery residency at Harbor-UCLA Medical Center and fellowship in vascular surgery at the Mayo Clinic in Rochester, Minnesota. Dr. de Virgilio is a vascular surgeon and a master surgical educator. He has received many local and national awards for his work with trainees of all levels. He has been a 9-time recipient of the Golden Apple Award for Faculty Teacher of the Year at the UCLA School of Medicine, and his surgical education textbooks continue to be the mainstay of clerkship, written boards, and oral board preparation for learners at all stages of training. His research interests are surgical education, cardiac risk assessment, and hemodialysis access. Without further ado, I'll turn this program over.
Thank you, Minerva, and thank you, Dr. de Virgilio, for joining us on this afternoon. We'll just jump right in and let's get started by talking about your background. If you could tell us a little bit of what took you to medicine, where you come from, why vascular? everything about you.
Sure. Well, primero de todo, muchísimas gracias por la invitación. Es realmente un honor. And I really feel that this new society is a very important one and has my strong support. So thank you for the question, Dr. Ulloa. As you mentioned, I was born in Córdoba, Argentina. My father, Miguel, was born in Córdoba, and his father, Francisco, also came from Córdoba. And we moved here as a child, and the way I like to tell a story, I was an immigrant really 3 times. I came to the US first as an infant. Then later, when I was 7, our family decided to give Argentina another try. So then I immigrated back to Argentina, which created its own set of complications, being that I had, now established my life in the US. And then a year later, we realized that financially it wasn't going to work. And we again moved back to the US. So again, another opportunity, so to speak, to be an immigrant. So, I'm fortunate that, I had the chance to come to the US, but, having lived in Argentina and having family there, and being an immigrant really gives you a different perspective on life.
Tell me more about the first time that you immigrated to the US.
Yeah, well, I think, it's important. I think it's important to learn to know someone, you need to know about them and about their history and where they come from and their family experiences. And I think the story that I always like to tell is of my own personal illness. And I think this sort of flavored my whole being. When I was 11 months old, I unfortunately contracted what I think now was infantile hemolytic uremic syndrome. And that was endemic in Argentina and is today as well. And I unfortunately developed complete anuric renal failure for 3 days, severe hemolysis, and I needed transfusions. The hospital didn't have my blood type, so there was no blood available. I needed dialysis, but dialysis machines didn't exist. And 4 other kids in the hospital with the same illness all died. And my parents decided to take me to this private hospital, but it required payment up front, which they didn't have. So my father had to sell his car, and then the check bounced from the car dealer. So this is how things began. And so it just turned out that, and this is to me still incredible to this day, hearing the story from my parents, that the intern on my service decided to have his blood checked, and it ended up being a match. And so he donated blood for me. But I still needed additional blood. And so the hospital sent out a radio call across the city of Córdoba asking for volunteers to come in to donate for this 11-month-old who was dying. And a random woman came in and was a match. And then it so happened that there was a doctor there who had just learned this new technique of peritoneal dialysis that just literally a year earlier had been developed somewhere else in Argentina. And he said, I'm going to try this on the kid. And after 3 days of anuric renal failure, I just started urinating again and somehow survived. So I think that, hearing the story as a kid from my parents of the struggles, of the financial struggles, the idea that, healthcare wasn't something that was guaranteed, and the volunteerism of, random people helping me, always planted that seed of medicine as a kid. And, my parents never let me forget those stories.
And then once you went back to Argentina, now having lived some years in the States, what was that like, and how has that shaped your approach to medicine?
Yeah, Well, I think it was a, as many of us who are immigrants know, that there are tremendous challenges, plus and minus, of being an immigrant. And, we came to the US with no money. But what we did have is my dad had a job. And so that, we're lucky in that way that we were able to do that. But I think growing up as an immigrant, as many of you know, nothing is guaranteed for you, nothing is given to you, nothing is handed to you. And seeing how hard my parents worked was very inspiring to me. Plus, we realized that we really had no family in the United States. There was no nuclear family, so it was really us. So we really learned to kind of depend on each other, and the importance of family was instilled in us early on. But then going back to Argentina, I had forgotten a lot of my Spanish, having been in the US for all this time. And so now I was viewed as, an extranjero in Argentina, because now I forgot the language. And so it was a tricky thing. And then when I came back to the US, now suddenly I was dressing different. I was wearing different shoes and clothes. And I actually, unfortunately, felt a lot of bullying when I came back to the US as an 8-year-old for being, very different in terms of the way I dressed, the way I spoke. I think that was the part that kind of drove me to sort of feel like I need to prove to the world that I'm worthy, because I felt this sense of not really belonging, which I recognize, is a theme among immigrants. But I was, again, lucky that I had a home, I had a parent with a job, there wasn't, I didn't have to suffer from poverty, but, I still, faced challenges that, not everybody faces.
I think that segues nicely into sharing kind of your journey in becoming a surgeon. Something that you kind of highlighted on just now is that oftentimes for us Latinos, or for us immigrants who choose A, the medical profession, and B, the surgical profession, there's often this struggle to appear familiar, or to have to work twice as hard as your counterpart to receive the same recognition. So could you just kind of discuss your journey and how that was shaped by your immigrant experiences?
Yeah, I think, I think that it's really important, and I have to, not that this was your goal, but I have to compliment you, Dr. Ulloa, because you've done a really nice study that I would recommend everybody to read, that talks about the idea of the importance of mentorship for Latinos and for underrepresented groups, and how the spark of a mentor at an early age can make an entirely huge difference in your life. And for me, what was really fortunate is that I had the opportunity to go back to, it's like I led a double life. In the US, I had no family, no one really other than my nuclear family to look up to, no guidance from aunts or uncles or anyone successful. But when I went back to Argentina during the summers to visit, I was fortunate because I had an uncle, Dr. Ruben Mostaza Sanchez, who was an ophthalmologist. And so as a teenager, he took me under his wing in Córdoba and took me into the operating room. And so interestingly, one of the first operations I saw as a 14-year-old was a vascular operation from one of his colleagues. Dr. Blanco was his name, I still remember. And so I think one of the things that I feel is really important is, having that person in your life who takes an interest in you, that sparks this hope, this dream that you can achieve something that you otherwise might not think is possible.
And who were those people for you in your journey?
Well, I think one of the key, and this goes back to, people who are sort of like yourself, one of the people that was really influential for me was Dr. Juan de Chago. And it turned out that as a summer high school student, there was a program for high school students to do research. And it was here at Harbor-UCLA in their research institute. And it turned out that the person who got assigned to me was Dr. Juan Lechago, who lived in Córdoba, Argentina for many years and was originally from España. And so he became my research mentor starting in high school, and we continued that mentorship in undergrad. And he was a UCLA faculty who wrote then a letter of rec for me for medical school. And to this day, I really believe that it was his support. And, you know, the reality is I didn't know what I was doing in the lab. It wasn't like I was some phenomenal laboratory person, but he, you know, he felt sympathy for, you know, an immigrant like me who had himself been through struggles and was very supportive. And I think, you know, if there's any message, I think that it's really important to start providing mentorship to students early on. You know, it's great to do it in medical school, but you really, I think, need to create that spark earlier, you know, whether it's, you know, even in high school, such as what I had.
You know, you've been a tireless advocate for surgical education, and I remember learning that you would hold these Saturday sessions for something like a decade. I may be wrong on the time frame, but every Saturday you would meet with the medical students and go over and help them prepare for their clerkships. Where does that drive come from? Where does that love for education come from? What's kept you inspired?
Well, I think first off, you know, both my parents worked in teaching capacities, and my mother was a teacher and my father was an engineer, but he taught at the university in Córdoba. And so I think having a family, you know, that's, I think, what really helped me, is having family that had teaching interest was an important part of my development as a teacher to begin with. But then I think the real key is that I was given teaching opportunities in college, and at Loyola Marymount University, they had a very important role for senior students to be teaching assistants, where you actually ran a lab and actually had to write an exam and prepare a course. And I think having that early experience as a teacher was important. And then Harbor-UCLA, when I was a student, had a tradition of emphasizing education, and residents who were very enthusiastic about education. I think the important thing is having educators around you was, I think, an important element in my own development as an educator. And I have to give my dad also credit, because he tells a story that when he was in college, he would study 16 hours a day because he wanted to be the top student. And he wouldn't go get his hair cut because it would take away from his studies. So his mom would cut his hair while he sat with his book. And so I think, you know, it's un poco loco, okay?
Yeah.
Mi papá es un poco, you know, but that's my dad. Yeah, and so I think having that type of, you know, drive, I think, is something that was inspirational.
How would you describe your teaching style in the operating room?
I've had the fortune of having now Dr. Ulloa is my colleague now at the VA, but I've had the opportunity to work with him when he was a fellow, and he's a fantastic surgeon. But I really like to emphasize the technique and to give immediate feedback and to try kind of step by step to help the residents in learning the right technique and doing a vascular osmosis. It's interesting because in some ways I could be very impatient. For example, if it's waiting in a line at the store to buy stuff, But when it comes to like teaching surgical technique, it's I feel like I could be there all day because I feel like there's an important. Yeah, I feel like there's something so critical in teaching the technique properly that it's worth my investment to do that.
Yeah, and that's another thing that's always amazed me about you is, you know, you'll take the time to just sit there with the medical students that are on service with us and teach them the details of holding the instrument and making sure that they understand that their actions have to be purposeful and that there's a repercussion to the steps that they take. As you reflect on your career, what would you say has been the biggest obstacle to just your general career advancement?
Well, I think, you know, I think I've been lucky in the sense that I was fortunate to get into a great medical school, and then I was fortunate to train at a great residency like Harbor-UCLA. And I think the key thing is, I don't know that I really have, I can't really say that I have any real critical obstacles. I feel like I've been very fortunate. I don't really feel like there's been, the real obstacles really occurred more in my childhood growing up and trying to get to college and medical school and not having the feeling of support of being here in the United States.
You know, one of the people that you mentioned was a big clinical mentor, Dr. Stabile, who was a chair at Harbor when he passed away. Could you just speak to kind of his teaching style and his influence on you, and how he continues to maybe inspire you in your trajectory towards training new surgeons?
Yeah, I think, you know, one thing that I think is important is that throughout your career, you end up gaining little bits and pieces from different people. And, you know, the person I am today as a surgeon is really a reflection of all the mentors that I've had. And Dr. Stabile, who unfortunately passed away recently, was really a great educator and mentor. And I think one of the things that I learned from him is the idea of being a little bit self-deprecating, you know, to use a little bit, to appropriately use humor in the operating when it was a reasonable thing. And so one of the things that he would say, you know, and I still remember this, I was a medical student scrubbed in with him, and it was a long operation that was quite tedious, and it was a highly selective vagotomy for ulcer disease. And he stopped in the middle of the case and then looked at me, the third-year med student, and he said, we're slow, but we do poor work. And it was just, you know, he was a phenomenal surgeon, but he was sort of taking a stab at himself. And I think it's important to be humble in the operating room. And, you know, one of the things that he really taught me also was you could tell that his goals in life were he was our department chair, was to make us all successful. He did not have as his goal to make himself grandiose or look good. And so everything was about how he could help his faculty develop as great surgeons. And I think that's one of the things that I have taken from him. You know, he was very patient in the operating room. He used humor appropriately and really looked out for his faculty. And I think along with what you're saying before about the students, you know, I've always kind of viewed myself as a bit of an underdog in life, you know, having grown up with this illness, coming as an immigrant. And I think it's important, and we tend to forget this, but as we grow up and become more successful, we sometimes forget what we were like when we started. And so I like to tell students stories of myself and when I struggled, you know, when I wasn't doing so hot, so to speak. And, you know, one of the stories I tell, and I think another, you know, inspirational person that I had was when I was an intern, one of my really great chief residents was Miguel Vélez, who was from Colombia. And he came here as an immigrant like me, and his name is Miguel, like my middle name and like my father's name. And I looked at him as just like a surgical god. He was just such a well put together, competent, skillful chief resident. And I said I wanted to be like him. And I remember my first time getting to do an appendectomy, and in that area they were open. So intern case was an open appendectomy, and it was 3 a.m. And he told me to make the incision, and as I cut, like there was no skin cut at all. Like I didn't know how to put enough pressure on the wound. And then there's a special move where you put your finger in like kind of a hook motion to get the cecum up. And he said, "Here, let me show you." Put his finger up, and they go, "Okay, here's the cecum." And then I'm going to put it back. Now, you get the appendix out. So I was fumbling. I couldn't do it. So then he said, "Okay, this is 3 a.m. He's like, "Okay, I'm going to do it again. Here's the cecum. Pop, there's the appendix. Okay, put it back. Okay, now you do it." And he did this like 10 times, and I could not get the appendix out. And I said, "How can I become a surgeon if I can't even deliver the appendix?" And I felt like a total failure. But he said, "Don't worry." He said, this is going to take time, and he says, "By the end of the year, you'll be fine." And so I think that was an important lesson for me is, the patience that he had, and then the encouragement that he gave me to say that, I was going to be okay, that I shouldn't just spiral into this self-loathing that I was going to be an awful surgeon. And I think what happens is I think we tend to forget as we get more experience, we forget what it was like to be the student. And I think the more you think about it, the more you remember that, I think the more compassionate you can be as an educator.
So it sounds like if you had to give your younger self, some advice is to not forget what it is to be the student. What other forms of advice would you give your younger self if you had that opportunity?
Well, I think it's also, to be a little more forgiving of yourself. And I think that as surgeons, and particularly today, there's so much scrutiny placed on you and your outcomes. Everything becomes very public quickly. And when an outcome goes negative, we have a tendency to, sort of hate ourselves or to feel that we should have done something different. And it's always easy to second guess that. Yeah. And it becomes sometimes you can really, particularly if there's a death, that can be a very tragic, difficult thing to deal with. And so I think that would be the one thing, is to try to be more forgiving of yourself when things don't go the way they should.
What's your life like outside of the OR? I know that you're a ping pong champion these days.
Well, I think this probably comes back to my my Argentine roots, is that, in Argentina, every time I went there, it was asados on the weekends and a lot of family time and time spent along the river. So I think I learned a lot of the importance of family and spending time with family. And so, full disclosure, I have 5 kids. My wife is a surgeon. And I'm happy to say that, and I'm a big football fan. And so I actually was fortunate. I played soccer in college, and I coached all 5 of my kids in soccer. And I think the important thing that I've always tried to do is to really make sure that I spend time with them, and to try to find an activity with each one that we can enjoy together. And so my daughters, I've taken art lessons with them. My sons have been a lot of sports. I'm, learning to play video games that aren't necessarily interesting to me, but and I think I think that's the one thing that I didn't want to, and I didn't want to be that father that wasn't available and wasn't around. And I think that comes back to also making career choices, and that when I was looking for jobs, some of the jobs involved call schedules and work schedules that I realized if I take this job, I'm not going to be able to coach soccer. I'm not going to be able to do these other things that I want to do. And so that's been kind of, I think, for me, a positive is that I've been able to engage in, in coaching, and I've done many triathlons over the years, and you have to understand my level of craziness, because you're saying the ping pong. I during COVID, that became my new sport, because I have a table in the backyard, and I ended up getting tennis elbow from playing too much ping pong. And this is the crazy part, is I hired a coach to teach me to play left-handed. So now I'm playing left-handed ping pong.
And wasn't that coach, your coach was like a prior professional ping pong
Yeah,
player?
he was on the national team of Peru. So we, yeah, so.
I think another thing that's incredible about you and your journey and your growth as a surgeon is how dedicated you've been to Harbor-UCLA and to the VA as well, to public health systems. Could you just kind of comment on why you gravitated towards practicing in those settings, and what would you say you'd like your legacy to be for Harbor specifically?
Well, thanks for asking that. And I think there's many reasons, and I think it goes back to the story of my childhood that, I basically am here today because my parents took me to this private hospital for children, el Hospital de Niños, el Hospital Privado, but had to pay and basically sell their only belonging for my care. And I've always felt that, healthcare shouldn't be like that. And so the county hospital, LA County UCLA, is particularly appealing to me because we deal with an underserved population, and on top of that, probably 50% speak Spanish, and so and the population is extremely trusting of me as the physician, and so I take that responsibility even greater, because if I don't do the right thing for the patient, they won't know any better, and so it's an immense responsibility to take care of them. And then, since many of them don't speak English, when I start speaking Spanish, they say, no hablo inglés, pero estoy hablando español. Oh, sí. They look at me and they don't expect that I'm a Spanish speaker. And then all of a sudden, the relief on their face is very palpable. It's like they almost, they trust you differently, because now they understand that you can explain things to them. And so I think that it's a combination of a population that I feel really is, needs us, combined with an environment that really puts a lot of emphasis on teaching, that attracted me to Harbor-UCLA. And the VA is the same. The patients there similarly are, I think, a great population that are, that you feel like you're needed there.
And what would you say is your hope for rising Latino students that are hoping to become surgeons, or what advice would you give them other than the things you've kind of hinted
Well,
at?
I would say that, it's number one, we need more great Latino students to enter surgery. And I also feel like you need, people to believe in you. And the person who believes in you doesn't necessarily have to exactly look like you either, because there are a lot of faculty out there who may be supportive of you, who may not be exactly like you. So, for example, when I was a medical student and then later a resident, Dr. Julie Freischlag, who many of you may know, has been a chair of surgery and is now the dean at Wake Forest. She was extremely supportive of me as a resident in pursuing vascular surgery, and I viewed her as a mentor. So I think, search out for for faculty who have an interest in students and then, really hang on to them, I think is an important. And also, I think since surgery is a field that obviously requires a lot of time and commitment, and I think it's important to start shadowing early on in year 1 and year 2, so that you enter your 3rd year with a sense of whether surgery is for you, as opposed to waiting till the end.
Well, thank you so much. I'm going to open it up over to the audience for questions now.
So I just want to take a moment and say thank you so much for participating in this, and thank you for your honesty and the stories that you have shared with us. It is very inspiring. And so we are going to go to the audience at this point, and there are a lot of questions for you. And so the first we're going to start with is going to be, what is your favorite part of the surgery program at Harbor-UCLA?
Great question. I think to me, it's really working with, it's really teaching in the operating room. And I'm a big fan of music, and I like to listen to music in the operating room. Not really loud, but when you have an eager resident who is really interested in learning, and you have the quietness of the operating room with a little bit of music in the background, I think that teaching people technique in surgery is probably one of the top things that I think I really enjoy. Well,
then I have to have a follow-up. What type of music?
Well, it's interesting. Is I'm pretty open to almost all kinds of music, but in the operating room, if you were going to ask me like what I would prefer, it's probably something like Sade singing "Smooth Operator."
Well played, well played. So one of the things that I found very interesting is that there are some students who may not test well, but they're very clinically adept, they're very capable. And so how can they relay this to the surgery programs, that their test scores and their step scores are not their true capabilities as a learner and as a worker?
Yeah, and we wrote an opinion piece in JAMA Surgery along with Dr. Neville, our program director, that was talking about USMLE and it going to pass-fail. And I really believe that the step score doesn't predict who's going to be a good physician. Mm-hmm. And I think the best way to express one's capabilities are, one would be through your clinical performance. And I think the most important, in my experience, the most important element of your whole application is how you perform in your 4th year on your sub-internships. Mm-hmm. And that then generates your letters of recommendation from your program. And I think the strength of letters can, I think, make a big difference in how you are perceived. But I do think the unfortunate thing is that until, if step 1 is eliminated, they're not going to go to step 2. And so it's not until all the step scores are eliminated that there's going to be sort of more equity in terms of true clinical performance. Yeah. And I would also add that growing up, like for example, when I took the MCAT and there was the reading comprehension, since English was not my first language, I didn't do well on the reading comprehension part of the MCAT. And I felt deep down that it really didn't reflect my abilities, but nobody would recognize that. Luckily, UCLA did, but I was literally, I think the last student accepted to UCLA off the wait list when I got in. And so somebody believed in me and gave me a chance.
A follow-up to that is, what advice would you give, or how would you advise people to seek mentorship? Nowadays, someone could even tweet you if they felt so brave. How would you approach finding a mentor?
Well, I think that what you'll find at most places is that there are clearly certain faculty who have a passion for education and an affinity for students. And it's a matter of kind of asking other students and probing and trying to ask, identify those faculty that have that interest, and then once you find them, hold on to them for dear life.
So we have a question about how do you get yourself ready to go to the operating room as an attending, and how is it different than how did you get yourself mentally prepared as a resident?
Yeah, that's a great question too. I mean, as an attending, one of the things that I do is I ask the residents usually to call me the night before, and we actually have a dialogue about all the cases that we're going to do. And so part of my preparation is hearing the residents tell me the plan, and that does multiple things for me. Is I view the resident as my extra brain that is going through the case and thinking about the potential pitfalls. And then at the same time, it confirms to me that the resident knows what we're going to be doing, and it's sort of a reminder of what we're going to do. And so I think to me, that's the biggest part, is having this kind of preoperative conversation. This is separate from we have our pre-op conferences too, but this is separate. I tell them, call me up, let's talk about the case, and then it gives me the opportunity to teach them a little bit and go over what if this, what if that. And so I think kind of anticipating the surgery and the next steps, I think, is an important element.
One of the group questions here is, you're a role model and inspiration. How do you do it all? Any tips in time management or organization?
Oh, well, that's very nice to say. But yeah, I have to say, a little bit obsessed with not wasting time. In other words, I typically have not been like a big TV watcher over the years. Over the weekend, I usually have a plan, even things like family time or exercise or going with the kids. There's always sort of a plan in mind of what I'm going to do. So like it may sound exhausting, but on a Sunday, I have a plan. I'm going to go with the kids on a walk to the beach. And so then we do that. I have a plan that I'm going to play ping pong. So then I have a set plan to go do that. I have a plan to do journal reviews or book chapter writing. And so I suppose I don't like to kind of waste time, and I try to make little lists of things that I want to achieve in that day that kind of help me. But it's not as if I don't have recreational time, because I find that by organizing it in that way, I feel like I have more time.
So we have a lot of questions from various levels about what are the best tips that people can do. So if you could answer, what is the best tip that you can give a medical student? What is the best tip you can give a resident and early career faculty?
Sure. I think, one thing I would say is, as a student, is that remember that ultimately the people that are evaluating you and judging you are the residents. Your goal should be to work well with them, and don't worry about whether the attending is seeing you or not seeing you, because eventually, if you do well and you're working well with the team, the faculty are going to know. So don't worry if you're not getting face time with the faculty. And then the other thing is, you might get asked questions by the team, like, what is this, or what is the most common cause of blah blah blah. And don't spiral into a panic if you don't know the answers. I think really people are looking for someone who, particularly in surgery, someone who is hardworking, someone who shows that they really care about the patients, someone who's really able to work together as a team. I think those are really the key elements for a student. As far as the resident, I would say that ultimately you're defined by your skills as a surgeon. And the most important recommendation I could give you is use every opportunity to scrub into the OR that you can, even if you're not going to be doing a lot. there's a lot to be learned from watching experts and watching what they do. And I think that, and also I would say, you never, if you're ever given the opportunity to learn something new in the operating or some technique, take that opportunity to learn that. And if I can I bore you with one more story?
Not a bore at all. Keep going.
So, back when I was, it's one of these back when I was a resident story. So people might now say, oh my God. But when I was a resident, I was in my 4th year of residency, and I was rotating at one of our affiliate hospitals. And one day, the OB/GYN attending asked me, could you help me with a C-section? We don't have any residents here in the hospital. We don't have an OB/GYN residence. And I was very busy doing trauma and everything else. And I finally said, okay, I'll help you. And so I went into the room, and the attending decided to take me step by step on all the process of how to do the C-section. And I thought, wow, this is really nice. And then apparently word got out from the other OB/GYN attendings that this surgery resident was willing to help with C-section. So for the next month, every 3rd night, somebody called me, can you help with a C-section? Can you help with a C-section? Can you help with a C-section? So by the end of the month, I was actually really proficient, as a future vascular surgeon with a C-section. And then towards the end of that rotation, keep in mind that we often didn't have attendings in-house. So in that era, we were often in surgery functioning alone. A young woman came in with a shotgun to her chest, full arrest. And unfortunately, we were unable to resuscitate. And when I looked down, she was visibly pregnant. And I proceeded with the ED physician to do a C-section, something I would have never thought of doing a month earlier. And the baby came out blue. And then within a minute started coughing and gagging. And the next day was neurologically intact. And I've never done a C-section since. And so I think there will be times in your life where you're going to be asked to learn things that you don't know why. And so that's why I feel like I'm teaching people things that they don't maybe know they need to know, but maybe one day that technique will make a difference.
That is an amazing story. And so many times we hear, things happen for a reason, and there are reasons that we need to be something. And I think that just highlights it. So we will stop with the audience questions at this point in time, because I don't know how we would follow that up, but don't worry, I have other questions that we will. So as you know, this is based off of the Inside the Actor Studio. And so there's a portion where there's always kind of a rapid fire, answer the first thing that kind of comes to mind. And so this is the portion that we're at. So we're going to start with, what is your least favorite word?
Least favorite word? Word?
Mm-hmm.
I think meal.
Meal. Okay.
I don't like that word. I don't know why.
All right. What is the sound or noise that you love?
I think, I think any kind of music.
Okay. What is your very distinct operating room preference?
I like, it's a joke, but when I'm doing AV fistulas, I like to sit on a specific stool, and it's maroon colored. So I tell the team, can I please have a soft maroon stool to sit on? And then everybody laughs, and then
I can get that. All right, to cut or to poke, open or endovascular approaches?
Well, I'm the old school Mayo trained open guy, and so I still remain an open fan.
Okay. To shunt or not to shunt a CEA?
I'm a shunter.
Okay.
Back to my Mayo days.
All right. What is one thing that you do every day?
I tried to sort of reflect on something positive in the day that's happened, and think about sort of the good thing that I have.
Okay. What profession other than being a surgeon would you like to attempt?
Would I like to be?
Yes.
Yeah, well, my lifelong dream was to be Maradona. And so, yeah, playing soccer in college, I would have, had I been good enough, which I wasn't, it would have been to be a professional soccer player.
Well, if you listen to the bio, I too am an avid soccer fan. I played in college as well, so I can relate. What is the best gift you have ever received?
One of the attendings at the VA took a photo of me doing an open AAA with a team of like 2 or 3 students and 2 or 3 residents around the room.
That's fantastic. All right, Boca Junior or River Plate?
Oh, okay, come on.
Had to throw that one in there. All right, that is the end of our rapid fire questions, and we're going to turn this over to our closing statements.
Dr. de Virgilio, thank you so much. Muchas gracias por acompañarnos esta noche. Before I sign out from everyone, I do want to ask a very important question, which is when you watch the World Cup, do you root for Argentina or Team USA?
Yeah, that's a really hard one. I think when it's Argentina, it has to be Argentina. Sorry. Anyone else, it's USA. And
fair enough.
Yeah, I have
fair enough.
Yeah, and I feel like for the country, it's so important for that country. And although the U.S. is little by little gaining, it's still not the same.
Unless you're watching the women's soccer team.
That's true. Yeah. Yes, they've been fantastic.
Well, on behalf of the Latino Surgical Society, again, I want to thank you for joining us tonight. It's been such an insightful program. I want to thank everyone who's joining us virtually. We will make the recording available shortly. Thank you to everyone who's tuned in. If you're interested in learning more about our organization or becoming a member, you can find us on latinosurgicalsociety.org and on our various social media channels using @LatinoSurgery. Buenas noches a todos.
Muchísimas gracias. Fue un placer.